Assalamualaikum warahmatullahi wabarakatuh, and every good morning to my madam Dr. Raiba and to my fellow friends. So in this topic is about cell and tissue. In this project title, I choose cell and tissue inside. Before we go through, my name is Muhammad Ridwan bin Mat Musta, and I want to tell you about the little recap about cell and tissue topic. Difference between cell and tissue. As we know, cell defined as the smallest structural and functional unit of an organism, which is characteristically microscopic. Cell function consists of growth, metabolism and reproduction. Tissue defined as the distinct types of material consisting of specialized cells and their products. Tissue have its own unique function. Structure of cell. There are many structures of cell. The first one is nucleus, plasma membrane, endoplasmic reticulum, cytoplasm, cytosol, flagella, mitochondria, and lastly is ribosome. There are 4 types of body tissue. The first one is epithelial tissue, muscular tissue, connective tissue, and nervous tissue. In this project data, I focus on the 4. The first one is disease, 2 injury, 3 aging, and 4 disorder. Learning objective about the disease. In this slide, students will be able to define the disease of leukemia that leading the accumulation, arterial growth, and accumulation of abnormal white blood cell. Disease, leukemia, nucleus. Mechanism for the leukemia, as we know, is a rapid production of abnormal white blood cells. These include genetic mutations, abnormal cell differentiation, and lastly disrupt signaling pathway. Treatment for leukemia, I choose chemotherapy and stem cell transplantation. Okay, rehabilitation for the leukemia, I choose horticultural therapy. Why? It's an ancient practice but already a new profession. 2. Use the plant and plant-based activity the purpose of human healing and rehabilitation. Learning objective about the injury. Students will be able to identify the injury caused by collagen fibers of dense regular connective tissue, which is primary component affect the ligament sprain. Injury, ligament sprain, which is the part of dense connective tissue. What the mechanisms? A common mechanism for ligament sprain involve a sudden and forceful twisting motion of joint. There are 2 ligament sprain types: inversion sprain and eversion sprain. Treatment, I choose the price strategy. Protection for P, protect your ankle by ivory weight bearing on it. R, rest your ankle by stopping all the activities that affect it. I, ice, cold compression with an ice pack. C, compression, wear an ankle support or wrap a bandage around the ankle. Lastly, elevation, elevate your leg to help promote good blood circulation and reduce the swellings. So let's recap for the video.
Rest, ice, compression, elevation. Rest is simple. Give that body part just a day or 2 to start to recover before you start using it again. I is for ice. Ice should be your first line of defense with an acute injury to address the inflammation. C stands for compression. If you have an ACE bandage, you can gently wrap the ankle or the knee to help decrease some of that swelling. Is rice. Rest, ice, compression, elevation.
Okay, rehabilitation for ligament sprain, I choose is strengthening exercise. In that strengthening exercise, there are many examples like FLA exercise, toe cycles, toe stretch. Learning objective, aging. In this slide, students will explain the concept of cell atrophy changes in the endoplasmic reticulum, or we call ER, which can impact protein synthesis and cellular function. Aging, cell atrophy, endoplasmic reticulum. What the mechanisms? Loss of cellular protein and organelles. Second, atrophy may involve the loss of specific organelle or cellular component. In this slide, look at the pictures. There are different between normal cells and atrophy cells. Treatment, I choose for stem cell therapy because prevent disease and injury. There are 2 types of stem cell. The first one, embryonic stem cell. 2, adult or somatic stem cell. Rehabilitation for the aging is physiotherapy because it helps reducing cell atrophy, which is integral part of rehabilitation. It aims what? Aim to improve muscle strength, flexibility and overall function. And the example is such as range of motion, or we call ROM, and cardiovascular exercise. Learning objective about disorder. Students should be able to understand the impact of Parkinson's disease on nervous tissue and examine the impact on nervous tissue function. Disorder, Parkinson's disease in the nervous tissue. What the mechanism? Dopaminergic neuron degeneration. Cause of what? Parkinson's disease is the gradual loss of dopamine processing neurons in the substance nigra. This leads to efficiency of dopamine in the brain, disrupting the normal communication between nerve cells and impairing motor nerve or motor functions. Treatment we choose for the medication. There are 3 types for medication. First one is levodopa, dopamine agonist, and third, MAOP inhibitors and COMT inhibitors. What the rehabilitation for Parkinson's disease? I choose for the exercise program. Why? Because exercise program is regular exercise, key component of managing Parkinson's disease. There are examples for the exercise program, such as aerobic exercise, strength training, and flexibility exercise. In this slide, I look at all my reference. Okay, that's all from me. Thank you for watching.